This presentation on reactive attachment disorder is for Dr. Leanne Jung's IEC 522 class. Reactive attachment disorder, or RAD, is a very serious condition in which an infant or young child does not develop or establish a healthy bond or connection to their primary caregivers, whether that is their parents, foster parents, or group home workers. A child with RAD is most often abused, neglected, or orphaned. However, just because a child may fit into one of these categories does not mean that the child will definitely develop RAD. RAD works by permanently changing a child's growing brain when the basic needs of comfort, affection, and nurture are not met during the early years of life. This interruption makes it difficult, if not impossible, for the child to develop caring and meaningful relationships in the future. Because of this, RAD is a lifelong condition with no definitive type of cure. RAD is divided into two subcategories to describe the different ways it presents itself in a child. The first type is inhibited behavior. This category is characterized by a child who shuns relationships or any type of attachment with everyone they meet. The second type is disinhibited behavior. A child who falls into this category will do the exact opposite and actually seek attention from everyone they come in contact with, even complete strangers. A child may use tactics such as constantly asking for help, having inappropriately childish behavior, or appearing anxious. RAD can be seen with many signs and symptoms in both infants and older children. A possible RAD diagnosis can be seen in an infant that is withdrawn or even listless. Those who seem to have no interest in the things around them, such as objects or people moving, or even toys in the general vicinity. Most babies will get upset or worried when they find themselves left alone in a room, but an infant with RAD will be calm and unconcerned when the last adult leaves. In toddlers or older children, even up through adolescence, RAD can present itself as a child who withdraws from others and dismisses any type of comforting comment or gesture. It may also be seen as aggressiveness towards peers, or intently watching a group activity but never participating. Also, things like never asking for support, consistent awkwardness, masking signs of anger or distress, and even drug and alcohol abuse in their teens can be signs of RAD. Thankfully, RAD seems to be a very rare and uncommon disease. Due to the difficulty in diagnosing, there are no accurate figures of how prevalent RAD is in today's society. Most experts will agree that RAD is more prevalent with children who are in the foster care system. One thing that can be agreed on is that RAD develops before a child turns 5 years old and often begins during infancy. According to the DSM-4, which is the Diagnostic and Statistical Manual of Mental Disorders 4th edition, RAD is one of the only childhood disorders that is caused solely by the maltreatment or lack of care by adults. This lack of care can take on many different shapes, such as having a constant disregard for the child's basic emotional needs and physical needs. It can also be seen in a situation where there is repeated changes in who the primary caregiver is that prevents the child from forming any type of stable attachments. There are many other factors that can increase the risk that a child may develop RAD. These can include any number of things, from living in an orphanage to extreme neglect to postpartum depression in the baby's mother. Even something like having parents who are inexperienced can lead to RAD if the parents choose not to reach out for help and support. But at the same time, remember that not every child who lives or comes from one of these situations will have RAD. RAD is a very rare outcome. There is no one true way to correctly diagnose RAD every single time. Experts will disagree over what signs and symptoms must be present or which types of evaluations must be done to get a true diagnosis. However, even with this disagreement, there are 3 criteria that must be met in each case in order to diagnose a child with RAD. First, the child must have disturbed and developmentally inappropriate social relationships beginning before age 5 that did not happen due to some other form of developmental delay. Second, there must be a failure to respond to or initiate social interactions, or a child who is being inappropriately friendly or familiar with strangers. And third, there must be evidence of a failure of the early caregivers to meet the baby's or child's emotional needs for comfort and affection, a failure of the early caregivers to attend to the child's physical needs, or repeated changes in the child's primary caregiver. And just like there is no completely standard way to diagnose RAD, there is no standard way to treat RAD either. Most treatments that have been found to have benefits include not only counseling for the child, but also counseling and therapy for the parents and the family. Also, looking into parenting classes or special education services can help a family begin to work through this disorder. One of the best things for the parents or caregivers is to get them in touch with resources and education about RAD. One of the best resources out there is other parents who also have children with RAD. There are websites such as radkid.org that is made especially for parents by parents. Within that website are additional links to other support resources, as well as book and literature recommendations and step-by-step guides of what parents can do now that an RAD diagnosis has been given. Resources like this will tell parents that love and caring for a child come through support and encouragement for the family, and also that every child deserves the chance.
I've been alone my whole life. I learned that I could only trust myself. Grown-ups won't care for me or love me, because nobody ever has. Pretending I'm strong is how I survive, but I'm scared and I'm hurting. I don't want to tell you because I'm afraid you will reject me like everybody else. You can help me, but let me know you love me. You will never leave me. Hope I can be a part of a family. Don't know how to find one by myself.